Since 1983, FAME has helped business and education work for Maine. Contact the authority, the Finance Authority of Maine. You're watching Mainebiz Sunday, Maine's business news source.
We're back to talk about the new federal health insurance reform law and how it impacts Maine businesses. Charlie Dingman, a member of Preti Flaherty Health Law Practice Group, is still with us. He was with us in our first segment. And joining us now are Trish Riley, Director of the Governor's Office of Health Policy and Finance, and Joel Allumbaugh, CEO of National Worksite Benefit Group in Hallowell. Welcome. Thanks for coming.
Thank you.
I mean, I'm glad you're here. I know we're not going to be able to cover everything because this is a huge issue and we have a little amount of time. But I wanted to get businesses kind of keyed in on this and bring in some extras to start talking about what should they be thinking about. So first thing I want to do is, you got to see the first segment. How did Charlie do? Did we cover everything we need to cover? Or were there other key things that you wanted to bring in that this bill will do?
He did a great job.
Great.
But I think the important message is this is an incremental approach. It doesn't fully become implemented until 2014. We have plenty of time to engage and talk about how best to do it. I think the notion of these exchanges is a changed marketplace for small businesses. Right now, small businesses don't have the capacity to buy as large businesses do, and as a result, they pay more. Yeah. The exchange allows individuals and small groups to create a new marketplace. It requires a very streamlined, standardized insurance market. It changes the rules. So you'll be able to go to a web place. There'll be four benefit designs, 2 additional plans that are multi-state plans that will be offered in the exchange. It will come with subsidies. But if you're a business, you can go online, you can look and compare 4 different benefit designs by the companies that are providing them, see what they cost, see what their quality is, and make real, simple comparative judgments.
Okay. Joel, would you add anything to the overview?
Yeah, I would just say that I think for companies immediately what they should be thinking about really is the grandfather plan status, because it's so significant. It's what hits them quickly. Right. Will their plan be grandfathered? That really comes into play, of course, in 2014, the significance of that. But they're going to need to be thinking about it at every renewal they have post March 23rd, 2010, when this bill was signed.
Okay, so they need to be paying attention to that right now. That's one of those things I want to make sure people can hear. Okay, even though it is down the road, thinking about that. Okay, Trish, tell us what, I know that you're working with the Joint Committee on Health and Reform for the state that the governor put together. Tell us what's going on with that and what the implementation kind of plan schedule is.
There's 2 activities. The Joint Select Committee of the Legislature is a group of 20 legislators who have taken on the look at what state law needs to change. The governor has created a steering committee of state officials and an advisory council of stakeholders that includes Maine businesses, it includes legislators from both parties. All those meetings will be in public, and we've laid out a plan of what a state needs to do to implement reform, what it needs to do when, and in each one of those points we'll have a public meeting, a white paper, a discussion of what it means for Maine, and bring businesses to the table, bring both parties to the table, and talk about what does this mean, what are our options, and what do we recommend the next governor and legislature might do to make this plan really work for Maine.
All right, I'm going to jump right into some more of the details. The whole question of the employers 50 and fewer. I mean, Maine is a small business state. That's who we are. I mean, 50 employers, that's a large business in Maine in many cases. How well is this really going to work for them, and how will this law impact them? And let me just, one thing that the National Federation of Independent Businesses has certainly criticized the law. They are joint partners in a lawsuit with other states about the constitutionality. They say that, quote, the individual and employer mandates, the onslaught of new taxes and onerous paperwork requirements in this unconstitutional bill will devastate small businesses. Let's speak to how will this really impact small businesses? Will they be able to do it?
I think if you think about the system today, it's devastating small businesses. They can't compete. They can't compete against big businesses. There's complexity in this system that is unfathomable to most of us. Most of us don't even know what our deductibles are until we actually have a problem and find out, oops, our coverage isn't there. This new plan, this new exchange, allows small businesses to pool together and increases the number of employees. You can be a business with 100 employees, join together in an exchange. The exchange can bargain on your behalf and bring about more competition, more choice in the marketplace. And importantly, the regulations on insurance companies that are included in this bill make insurance understandable for the first time. It requires the same application forms, the same billing forms. It simplifies it, makes it easier for us to understand.
Is that the way you see it? I mean, that's your business, is really understanding those and advising on how to do that?
You know, for me, details matter.
Yeah.
And it's so complicated today, and working with employers to kind of navigate, even to think of, you know, a handful of insurance choices. I mean, today small employers have potentially dozens of insurance choices. And our challenge is always translating that to terms that make sense and helping you know, make those selections. But I think it's really going to depend on the details. It's cumbersome today. It could be more cumbersome. It could be less cumbersome, and how those details flush out is certainly going to impact my life and the small employer's life.
Okay. And I think it's very hard to know at this point exactly what those details are going to look like, because there are a tremendous number of regulations yet to be written. There are massive changes in organizational charts in the federal bureaucracy that need to occur. People need to tool up and then prepare these rules, put them out for public comment. So we've got a long distance to go yet.
But it sounds like, though, that I keep thinking of this as the tablets handed down from on high, and they are from the federal government, but the states then do get to interpret them and have a say in how those are implemented and how it's communicated. Is that going to be the word?
To a large degree, though, I think we don't yet know. I think the important thing, though, is that we do have a long ramp-up period here. And initially, the federal government has shown itself to be far more open and far more willing to work collaboratively. They're not just handing out edicts. They're bringing people in, figuring out how to do it. This is a big piece of work, and it is requiring everybody at the table to figure it out. And I think that's hopeful.
Okay. I want to ask a question about jobs. That's the other thing we're interested in. How does this affect the economy? Obviously, it's about health insurance, but also how does it affect the economy? During the debate, and often it was called a jobs killer. One of the parts was because they thought, well, you know, there's going to be a chilling effect on growth. You won't want to, employers won't want to exceed that 50-employee limit. Do you think that'll actually have an impact? What are you hearing out there?
I think it could, and I think, again, it translates to those details. And when you talk about plans or companies that are 50-plus having to make sure that their plans meet these new standards, you know, I think a lot of it depends on where they are today. Does that mean having to purchase a more expensive plan? I think when you take into consideration part-time equivalents, there may be companies who don't think they're 50-plus that are 50-plus in the definition of this, and
as
will
far
that
as
impact them?
regulators go, too, they're going to get businesses. One thing they're good at is getting clever, and they will get clever with the 50 number and how to do it, so that's probably all going to be worked out.
Which is also why a collaborative rulemaking process makes sense. But I think we have to keep in mind there are lots of details, you're right, that we don't know about, and we need everybody at the table to figure it out together. But importantly, businesses are killed today by the high cost of health care. Covering everybody matters, because if we don't, there's a hidden tax on all premium payers of uncompensated care. So that matters. This bill does it. It does also talk about payment reform, new ways to pay for more efficient health care. There are enormous investments here in prevention. A very important investment in public health and prevention, new wellness credits for small businesses, 5-year grants, and an important demonstration in medical malpractice.
We have to wrap this segment, but I want to ask each of you to kind of real quickly weigh in. What's the one thing, if you were advising, well, you do this, that's what you do. You guys actually do advise businesses. If you're advising businesses, or if you were a CEO of a small business out there, what was the one thing you'd be doing right now to be prepared, to start getting prepared for this? Joel?
I would, one, get the right advisors. There are a lot of people in this business. There are not a lot that are really delving into the details of this law, and they're going to need to have that kind of guidance. There are so many details that potentially could impact them, and I agree that 2014 is a ways off. I also think it's going to come rapidly fast for all of us. So.
Okay. Charlie?
I would agree. I think that any business should be looking at what their strategies are, you know, internally, for providing a health care benefit. What do they want to accomplish? And then mapping that out over the next 3 to 4 years and thinking through, what do I have to do to change? And as Joel said earlier, take a look. If you've got a plan, you've got to watch every renewal and think through whether you want it to stay grandfathered, whether you want to jump on to some of the new features and opportunities. There are choices to be made that need to be thought through carefully.
Okay. Trish?
I would say immediately look at the tax credits. There's real money on the table for small businesses and see if that works for them. And secondly, keep the politics as calm as we can on this so that we can all together figure it out and make it work.
Well, that's what we're going to come back and talk about. I want to keep you around. We're going to have kept you around for our afterthought segment we do on the web. We're going to talk about some of the politics of it and kind of what we can really expect going down the road. So hopefully people will turn in on the web to see some of those answers as well. Thanks. Stick around.
Thank you.
Our panel continues this discussion of how the new federal insurance reform law will impact Maine businesses in our exclusive afterthought segment, seen only on the web. Go to Mainebiz.biz and click on the Mainebiz Sunday link. We'll be right back.
Mainebiz Sunday is made possible in part by funding provided by the Finance Authority of Maine.